right, welcome back. The CDC says the country is dealing with high levels of respiratory illnesses. On the list, COVID, the flu, RSV. The agency estimates at least 3 million people have become sick so far this year. 11 states have high levels of respiratory illnesses. One state, New Hampshire, is reporting very high levels. Emergency room visits for all 3 viruses are trending up, with most of them for the flu. And doctors say it's still not too late to get vaccinated. That's the best way to protect yourself in the coming months. Talk to your parents, grandparents, and your doctors. Yeah. The CDC also says norovirus cases are on the rise this holiday season. 91 outbreaks were reported nationwide during the week of December 5th. That's roughly 24 more compared to the last week of November last year. But the numbers don't tell the whole story because health departments aren't forced to report cases of norovirus, so we really don't have great numbers. Meantime, norovirus is the top cause of foodborne illness, with roughly 2,500 outbreaks reported each year, and it is bad. It's yucky. Yeah, so you don't want that.
Actually, we do need reporting, good reporting on this, so we can give you a number and tell you where it's stronger and higher.
The new year has also started off with a lot of sick days already. Doctors say the flu and the stomach bug are going around.
That's right. Fox 59's Hannah Fullman talked with some experts about what we're seeing in central Indiana hospitals and what we all can do to protect ourselves and, of course, your families.
If you've been feeling a bit under the weather lately, you are not alone. This is the time of year when both respiratory and gastrointestinal illnesses are spreading rapidly.
Flu activity is high in Indiana right now, according to the Department of Health. And according to the most recent CDC data, cases of norovirus or stomach bug are up at least 30% since the end of November.
This is the perfect storm. All kinds of different things show up this time of the year.
Dr. John Christensen is the Associate Medical Director of Infection Prevention at Riley Hospital for Children. He says this is usually the worst time of year for sick calls.
We know that we're on the rise, and you just look at our numbers from week to week, but this is the worst time of the year for all kinds of respiratory infections, but also for even norovirus.
The main reason is how these viruses spread.
We see this surge every year. I think the number one reason is that the viruses tend to persist in the air as aerosols longer because of the humidity and the cooler temperatures.
And when you combine that with all the holiday parties people just went to and more people staying indoors for the colder months.
No question that it's the worst time of the year this time. These viruses will survive on surfaces for a long period of time. Norovirus in particular, RSV, influenza, and norovirus is one of those viruses that you only need probably one infectious particle for you to get infected with it.
The good news is most cases don't need care outside of the home. But here's when you need to. For norovirus,
if they're vomiting and their vomiting is out of control, then they need to have somebody see them.
And for respiratory illnesses like the flu or RSV.
If they think the child is having difficulty breathing, they should take them to the urgent care or the ED.
The most important thing you can do is take extra precautions, like washing your hands thoroughly for at least 20 seconds. Disinfecting commonly used surfaces like your kitchen table, and staying away from people who are sick. Reporting in Indianapolis, I'm Hannah Fullman.
Fresh health crisis now looms large in China, this time involving an outbreak of a human metapneumonia virus, HMPV, just 5 years after COVID-19 pandemic. Now, reports and viral social media posts suggest that virus is spreading rapidly, with claims that hospitals and crematories are overwhelmed with dead bodies. Videos circulating on social media show overcrowded hospitals, with users alleging simultaneous circulation of multiple viruses, including influenza A, HMPV, mycoplasma pneumonia, and even COVID-19. While there are rumors of a state of emergency being declared, officials have yet to confirm it. Remember, HMPV, known to cause flu-like symptoms, is under close observation by health authorities in China.
那么都有可能容易造成感染。
Thank you.